Well, hello, this is Erika Hood with the Center for Reducing Health Disparities, and I'm here today with another one of our community spotlights. And today we are highlighting FrontLine Services. So I want to thank you all. There's the team here with us today who's doing great work at FrontLine. And Kim, you're connected to the center, and I want you to introduce yourself and your colleagues, and you all just give us a background a bit about the organization and what you all do.
Sure. Hi, everybody. So I'm Kim Kiley. I am the Research and Evaluation Specialist for the trauma programs at FrontLine. And today with me, I have Rosemary Creeden, who is the Associate Director of Trauma Services at FrontLine, and Aaron Rentrope, who is the Program Coordinator for the Children with Incarcerated Parents program. So we all work in one part of FrontLine, which again is the trauma programs. So FrontLine serves all kinds of people. We have a pretty wide mission to reach out to Cuyahoga County's most vulnerable and provide resources that are needed to end homelessness, prevent suicide, resolve behavioral health crises, and overcome trauma. So again, we're the overcome trauma piece of the mission. We have several programs under the trauma umbrella. We have the Children Who Witness Violence program, the Traumatic Loss Response Team, the Defending Childhood Initiative, and again, the Children with Incarcerated Parents program.
Awesome. And I would have to imagine that a lot of your work is done in a personal way, and using various platforms and various levels of engagement with folks in order to address trauma and work in that lane. So how did you all respond with the pandemic a year ago? Like, what happened and what did that look like as so many of us made adjustments?
Erika, it was one of the most challenging parts of my entire 40-year career. Thinking about the people that we serve and the kind of crisis they experience, and then seeing such an exacerbation in those crisis situations, and trying to figure out how can we continue to serve our families on a daily basis in the middle of probably one of the worst times we've experienced in our country with this pandemic. And so, we're a kind of unique agency, I think, FrontLine. We are very slow to give up on direct service and direct contact. And so we made all kinds of adjustments to our service, but continued, because of the nature of our service, continued to see people face to face almost throughout the whole year. It was just because of the nature of the situations that the people are encountering that we serve. I mean, an example of that would be like in the Traumatic Loss Response Team, you've just experienced a homicide in your family. So talking to someone on the phone or talking on telehealth, it's just not the same.
Central work, truly. Yeah, honestly. Yeah.
It's just not the same. And so our staff and all of us were creative in that, we met people in the backyard. We met people, and also we had to be very conscious of HIPAA. So it was just all kinds of constant, I would say on a daily basis, saying, okay, what are the referrals we have today? How can we manage and best serve those clients? How can we best serve those families in a way that is meaningful and with the overlay of and keep our staff safe? And it's been extremely challenging. But I'm going to ask Aaron just to talk about, in a very unique way, the challenges of the Kids of Incarcerated Parents project, because I think they had unique challenges in that project. Go ahead, Aaron.
Yeah, so, FrontLine, we dive deep into our service, our direct service with all these different families and individuals and children. And a big piece of that is working with partners throughout the county. And so one of the partners that we had for our program, Children with Incarcerated Parents, was Oriana House and their community-based correctional facility over at the McDonald Center. And so, with the pandemic, the ODRC, the state body that determines the policies for the correctional facilities throughout the state, they restricted family visitation and a lot of different services that were coming in and service providers that were coming into the facilities. And so that was one of the first big barriers that we had to try to overcome, or at least be confronted by. There was a lot of other types of barriers with the courts closing. And so people would have cases that were just open for an indefinite amount of time. And how are we going to deal with that? The facility isn't socially distanced. And I think we saw throughout the country, people being released a bit early. Their risk scores were being reevaluated. Who's the lowest risk? Who's the most appropriate person in terms of public safety? And then looking also at each individual, do we have people that are over 65 years old? Are they maybe low or medium risk? Maybe we can let those people go first. So we had a lot of turnaround with that. Our program is designed to deal with the childhood adverse experience of parental incarceration, along with all the different experiences that come with that incarceration. So it could be domestic violence in the household, it could be substance abuse, it could lead up to homelessness and all the different things that we see out there. And we're trying to get out there and we're trying to support these families and support these kids, knowing full well that this is a place, an important part in that child's life and that family's life. And so we're also seeing those factors exacerbated throughout this process as well with the pandemic. We see that kids are being left home alone, that the schools are shut down. We're seeing that, unemployment is stressing out people financially. And so, yeah, just seeing all this need out there was really intense. And I know so many other service providers were going through the same thing. And just seeing how willing our partner was to work with us, to do everything that we could do together to support our families in the community, to make contact with the guys that were being released a bit early, figuring out how to make all of those ends meet as much as possible was kind of the way that we got through it. We had families that had to deal with reunification pretty early on. And I think that timeline was a lot faster than they anticipated, a lot faster than we anticipated. And so we had to just kind of jump around and go sideways and this way and that way to just kind of support people, support families, making the best moves that they can with as few resources as they have, and just trying not to overstep all the different boundaries and all the different policies, right? So yeah, I can't really, it gets so granular, and it's hard to really to speak to how specific each little thing was. It felt like this family is this very specific situation, and this family is this very specific situation. Yeah. And I'm going to work with my partner Oriana House to give me just enough leeway, just enough gray space, so that I don't have to treat this family the exact same way as I'm going to treat that family. And it was such a blessing to be able to get that leeway from our partner. And I know FrontLine had that same type of relationship happening with all the different partners that we work with.
Yeah, I think partnerships, what we have seen, looking at our community respond, it has been those partnerships, and really like our grassroots organizations too, that had the most flexibility to make calls regarding their constituents. I think we've seen them step up where government and more formal agencies had to step back, and they could not, touch clients or, be in the office. So you really saw community organizations shine. And it's like, I wish we can just have some type of award ceremony to give everyone, their roses, because they have stepped up to the plate to really make things happen in the midst of such a trying time. So when you mention partnerships, I think that is just, it's awesome because it shows this network and how important it is. And, I thought about too, outsiders looking in at your program, and specifically, Aaron, I would say, wow, some family members are seeing, their loved one sooner than they would have thought. That is great. The coronavirus, something good came out of that. Someone came home early, but then it's like, you never know the many layers of family dynamics and structure and the emotional impact that comes with. So thank you for bringing that up, because we can just be so naive to the many different layers that you all are working with there?
Yeah, you get somebody home earlier and they're unemployed for 3 extra months, or the court's closed and they can't resolve their protection order, so they're illegally staying together for 3 extra months.
Right.
And
Yeah.
so, yeah, it's so unfortunate that those layers have to happen. But what we're trying to do is just try to help people get the most out of it.
So I see how you all, made those shifts and changes to where maybe your original programming changed to address some of the most immediate needs to the young people and the families that you're working with. How did that kind of happen for Rosemary? Kim, how did that happen for you with your programming, where you saw like immediate shifts in the work that you had to do?
Well, I would say, I mean, we just had to figure out, is it literally safe for people to be in the community, in people's homes? And we also, at the same time that we were dealing with the coronavirus, we were dealing with a tremendous exacerbation of violence in the city area. Tremendous. I mean, we had 175 homicides. And so I had to think about that. I had to think about sending staff and myself. Everyone here goes in the community. None of us are, we all do work. Kim more over the phone with satisfaction surveys, but the rest of us are in the community. Like, how are we going to balance that?
Right.
Where, we're sending people, good, wonderful social workers, to people's homes where there's been a homicide and where there's been severe domestic violence, and along with there's a pandemic. And what I can tell you is, we as human beings, that's putting my mask on when a social worker comes over is not what I'm thinking about when my son's been killed. It just isn't. And it's unrealistic to even think like that. So those kinds of shifts of like, okay, well, maybe like this was probably, I feel like was probably our biggest shift. One of the things in all of the programs, knowing and understanding these populations, and understanding what trauma does to families, is, we always, just when we receive referrals 24 hours a day, 7 days a week, we just go. We don't call families. We don't, because people can't manage. It's too much. So for the first time in actually 20 years, we really started calling people before we came, and that was a big change. And in many ways it creates a barrier, because it's easy. It's hard for you, Erika, when I'm standing on your porch with help, to say, Rosemary, go away. But it's a lot easier to say, Rosemary, go away, when I'm on the phone. And so that was a change for us, and that was hard. And so we had to really increase those efforts to engage with people. Some people were more easily engaged on the phone than others. Some people were not. And so then what we did was we would say, well, are you comfortable if we come and we'll meet in the backyard? And during the spring and during that was fine, and all through the summer that worked out. And I think that was an accommodation we made. It was difficult in the winter, I'll be honest with you. It was, I mean, Aaron, what would you say to that in the wintertime, trying to meet with families in the community?
Yeah, that was, it's so hard to look back at all this stuff because it's so painful you get all that sense. But yeah, it was very dicey, because you can't be in the home, but then you also need to get people's paperwork so that HEAP is together, or PIP is together, so their utilities and the heat and the electricity and all that stuff is on. So yeah, there was something pushing you out of the door each and every moment, and at the same time there was a whole force kind of keeping you at base sometime. And yeah, I did a lot of work out on the porch, standing in snow piles and stuff like that. And I'm sure a lot of other people at the agency were doing that. And, fortunately for me, it was just the basic case management and things like that. But when you have, the DCI program, or children who witness violence, and you're trying to go through trauma-focused cognitive behavior therapy, you can't really do that from the porch. And it's difficult to engage an 8-year-old for an hour on the phone. And so all that stuff, I'm not sure how those people got through their services, but they did. And, you know, everybody has their own little heroic story.
And the other part that I think was interesting about our agency, Erika, is the clinic never closed. The doctor said, no, we've got to keep seeing our people. And I'm sure there are other mental health agencies that continued also to see people face to face. But boy, in my mind, those physicians and nurses across at the agency, they never stopped seeing people face to face. And I thought that was rather remarkable.
Yeah, I think, you know, the pandemic, it uncovered a lot for so many people, the things that we took for granted. I think, you know, the behind the scenes operations of some of our most vulnerable community members who are going through so much that we like to kind of forget is happening because it's too hard. A lot of that came to light, you know, during the midst of the pandemic, and you all talking now, I think will be helpful for some of our listeners and myself just to, you know, be grateful and recognize you all for your hard work. I can't imagine the fear that I had early on in the pandemic, having to go into someone's home and deal with something that was already so painful and traumatic. You all are just, you know, you're awesome. And I really just commend you and the entire staff for just making that, continuing to do your work as best as you could, despite. So I just had to say that. And I thought about mental health services. You know, this was a time where many of me and my girlfriends talked about, you know, therapy. Oh, we have to make sure we get back on our therapy train because this has been so hard. And, you know, and this is me who I'm blessed, you know, I have a home and a job. So, you know, I just can't imagine folks going through anything tougher than that and not having the support that you all offer. So this is super.
Well, I think the other part that was particularly difficult in TLRT, along with, you know, the service, along with everything about it, but was the fact that people couldn't have funerals, Erika.
Yeah. Yeah.
And people couldn't come together and support each other. And I can't even begin to talk about the impact of the grief journey when you don't have that closure. So you compound that with, I couldn't have first of all, well, let's just start right from the beginning. I couldn't really go to the emergency room because I'm not allowed in the emergency room, and my son is deceased in there. I can't really have a funeral because no one can come to the funeral. And then, as Aaron pointed out eloquently, I can't even have a trial. I mean, there's no part of this process that I have closure. Do you think that's too strong a statement, Kim, with our folks?
No, not at all.
Wow.
And I think that's the way it's been for them for the whole year. Mm-hmm. Very tough.
I think this spotlight was just for me. Like, I haven't, you know, going through rough time. We lost, you know, some family members, and, you know, for our families, think about funerals and repasses is when everyone comes together for food and, you know, trying to find some joy and love in the midst of that time. And without being able to do that, you know, I think was really tough for our family and others. But now you're saying this and, you know, adding on violence and homicide and court systems, things that you have no control over. You know, this is just very eye-opening. So I appreciate you both. I mean, you guys for offering this up. This is great. So Kim, my question, what are partners saying during the midst of this time? How did you all do? How do you feel that, you know, you did despite such challenging times? And do you have any, you know, insight into how some of your participants felt during this time?
So I can say, you know, our participants, so I call families to, you know, find out how services are going. And, you know, it ranges. They're always grateful for the services. You know, sometimes I hear things like, you know, she did what she could do during this time. Because again, they'll go out, for example, children who witness violence, they'll still go out and do the assessment to see if their child needs longer term counseling. But then are there services available for that longer term counseling after the assessment? Or how long do they have to wait? Or is there in-home counseling available during this particular time? Or if they want more, you know, like a mentoring or some extracurricular activity, are those all shut down? And so, you know, that's been challenging for our staff just to be able to offer services that normally would be available. And it was always, it's always changing too. One minute, one agency is offering in-home or office space, and the next minute they're not, and it's all telehealth. And then of course the digital divide. Are they able to meet? Do they have everything they need to do it that way? And then as Aaron or Rosemary, I forget who mentioned, the big thing with the kids is they can't do this on the phone or over Zoom or Teams, because a lot of the work that our counselors and social workers do with the younger ones is more play-based. They meet kids at their level, and so that's really hard to do over the phone or through Teams. So but then there's others who feel that they've gotten everything they need, and it just it depends. They understand, our clients are understanding that it's just, it goes with the times, and that we're doing what we can. So they are very understanding.
Yeah. So are there any procedures or processes that you all will take with you as we hopefully come out of this pandemic and you move forward with your work? Are there some things that you'll hold on to that worked well? I know I'm kind of putting you on the spot with this question, but I think it's interesting to know. For many of our organizations and agencies, we're like, we like this. Why did we never do this before? What did that look like for you all?
Go ahead, Kim.
I'd like to just talk a little bit about some of the resiliency work that we're doing. So FrontLine is really emphasizes the importance of resiliency work, because as you've heard, the work that's done at FrontLine is really challenging for staff to be working with vulnerable and traumatized clients all day. There's a level of exposure where people are at risk of compassion fatigue, secondary traumatic stress, burnout. And so we in the trauma department have been having a resiliency group that's gone on for at least the last 10 to 12 years, twice a month in person, 1.5 hours a week. And in March, we had to switch over to virtual. I facilitate that group once a month. And so I needed to figure out kind of how to make that work, how to make that support system still exist amongst these challenges, and especially during a pandemic when we support each other very organically in the office, but now when we're all based out of our homes, how does that work? And so there was a lot of adjustment there in that respect, and just really being intentional about supporting one another. And so we recognized that this virtual resiliency was really important, not just for the trauma department, but for the whole agency. And so we opened it up to all of the agency, and we included a local artist, Guy Vincent, who had been working with the guys at the through Children of Incarcerated Parents. And so we created this hybrid model virtually. We just kind of said, okay, what things translate well virtually that can be stress relieving, can help people connect. And we created this model. And your question, what things will we use moving forward? I think, yes, of course, groups and resiliency groups are best in person, but there are some barriers that are reduced by doing it virtually. For example, we have several sites across FrontLine, and one of them's out in Euclid, one's right by you at Metro. Now we've just reduced travel time. And so people who might not have come otherwise because they're already taking 1.5 hours out of their day are coming because all they have to do is click right in. And so that's been a big barrier that's been reduced. We can have groups, and we have, that have 50 people in them.
Yeah.
And what we do is we do the activities that can be done in a mass group, such as like a guided meditation or chair yoga, and the art activity in one big group. But then we break off into breakout rooms and have smaller group discussions. And we have several facilitators. Aaron's one of them. And it's just, it's something that I never would have considered before, but it really in some ways is a really powerful tool to be able to connect with a lot of people at one time who are all over the place. And so I think moving forward, I hope that, you know, we are able to still use technology in ways like that, where we can connect with a lot of people, where we can connect with people from further away. Yeah, it's not all bad.
So along the same line of it's not all bad, what does the future look like? Things are looking, we see the light at the end of the tunnel. So what does that look like for your work and working with your participants there?
I think the future is going to look in the ways that Kim noted, different. I think like with the Kids of Incarcerated Parents Project, one of the things we're doing is virtual support groups. And I think that we'll probably keep that model, because I think it's easier for moms and kids to attend that way. So that's kind of exciting. And I think we're just on the cusp right now of returning to a little more normalcy in the agency. We're just on the cusp of considering, you know, a real basic thing, transporting clients again and seeing people in the office more regularly, and us in the office being able to meet as a group. I mean, just that kind of normalcy is going to help us all tremendously, I think. And I agree with both of you. I think that some good will come out of this. I mean, and maybe, you know, maybe we will move to a more, for those that are more comfortable doing things, you know, telehealth, maybe that will help us to serve more people, because we will cut down on the travel time. But as I think about the projects that I run right now, what I'll be most happy to see happen is for the people who are incarcerated to be able to have family visits. Aaron, do you want to talk about the impact of that?
Of the families that,
being able to come and have enhanced visitation.
yeah, so that's going to be huge. I'm just thinking about a few of our families off the bat, like somebody went in a little bit after their baby was born, and over the past 3 or 4 months, the baby got COVID, you know, and it's only about 4 months old, and that's got to be terrifying. And you know, we just the other day on our last art night, we were able to connect them so that they could see each other on Zoom and do a fun little activity and get to see their father do something that's, you know, just kind of fun and different and relaxing. It's not so heavy, and they're in their own home while they get to do that. They don't have to go to the facility. So that's something that was easy to see and you know, better than it was before. And I think even better would be once we're able to get back into the place itself. Our program is redesigning one of our family visitation rooms, so it again doesn't have that feel of a correctional facility. And ideally, we'll be able to have, you know, the father embrace his 4-month-old child that is negative, that is able to get past COVID, and just you know, shed a few tears and just have that moment with them. Yeah. I think another big thing for the agency is really seeing, like you're saying, we have this extremely marginalized group and this historically marginalized population that we work with in this agency, and seeing the strength that people have, seeing the role that Black excellence plays, if we can say it, and keeping people together, keeping families together at a time like this. There's something that should be said about that, about the resilience that's in the community that we serve. And I think that as an agency, we're just kind of seeing that a little bit differently, and we're engaging it and we're revering it. And I think it's something that is really positive when I talk to other staff moving forward.
Yeah, that's a definite takeaway. It saddens me that there has to be such a strength in the community to overcome some of the hardships, but
There we go.
thank goodness it's there because things would be a lot worse. So that resiliency goes a long way, and grateful for that. Well, I thank all of you for joining me today on this call. If there's any last things that you want to share, please jump in. If there's a message of hope that you want to share with those that you engage with, feel free to send that out to them now. But I have no more questions, and I thank you all. Okay.
Thank you so much. It was such a pleasure being able to speak to the work that we do.
Thank you.
Thank you, Erika.
You're all so appreciated. So thank you so much. And if anyone wants to learn more about the programs that you do offer, where can they find more information?
FrontLineService.org.
Okay.
If you just Google Frontline Service, it'll come up.
Okay, perfect. Thank you so much. Right. Thank you.
Thanks, Erika.